So guys, managing psoriasis is a different story and curing psoriasis is a different thing. Let's first understand how to manage the cases of psoriasis. Consequence medicine are you using in your practice, guys? We have wonderful bunch of remedies. We have wonderful list of remedies that works excellently in cases of psoriasis. But what are the common medicines you all guys are using in your practice? Let's first discuss about them. Anyone? First of all, never get afraid with the name of psoriasis. As a homeopath, all skin diseases are common for us. As a homeopath, we need a symptom. As a homeopath, we need a totality of symptom. So guys, don't just get afraid with the name. You can prescribe medicines from them, from the basic symptoms. What are the common remedies you are using in your practice, guys?
Natramure,
Yes, Natramure Pankti. Then myself is using Natramure very frequently. Yes, from Bhumi, that is arsenic alb. From Bhumi, that is sorinum, sulfur, sorinum sulf, okay. From Urvi, that is ars iode, one of my favorite remedy. Another is X-ray, yes, that is very much helpful. Graphitis, yes, that is also helpful. From Dhruvi, that is sorinum sulf and graphitis. Okay. Any other remedies are you using in your practice, guys? In cases of psoriasis?
hydrocotyle,
Yes, hydrocotyle. Anything? Yes, Richa, that is Restox. That is also frequently used remedy. Let's begin with the basic. Whenever there is season modality, as we all know, dryness is severe. As we all know, scaling is there. So our wonderful remedy, that is petroleum. Believe me, petroleum works like anything in cases of psoriasis. As we all know, dryness is a key of psoriasis. If that dryness is aggravated in cases in typically in winter season, जब भी winter में dryness बढ़ती है, that is very common thing. As patient having dryness, so the dryness is aggravated in winter. That is common thing. If we get the common symptom like that, if we don't get any other symptoms in the patient, so we can think of petroleum. Guys, in cases of autoimmune disease, in cases of chronic disease, constitutional approach is the one of the best approach. If you get the proper case, if you get the constitutional approach, definitely that helps. But when you don't get such constitutional approach, when you don't get the whole case, at that time, this specifics works, guys. Believe me, constitutional approach is the best approach that is going to work like anything. But these are the remedies when you don't get such thing, when you don't have time to take a whole case of 1 hour or 2 hours. In those cases, the specific remedies helps a lot. So when there is dryness, which is aggravated in winter, in those cases, you can think of petroleum. You all know there is cracks and fissures in cases of petroleum. So when there is psoriasis, that is plantar or palmar psoriasis, even in those cases, you can think of petroleum. If that dryness is aggravated in summer, when I was in my college life or in my initial practice, I was thinking, summer में तो dryness कैसे बढ़ती है? कैसे patient आएंगे? Summer aggravation. So that we are seeing infrequently in our cases, frequently in our practice, the patient came to us and he used to say कि winter की जगह पे मुझे summer में dryness बढ़ रही है. Yes. So in those cases, you can think of sarsaparilla. इनको explain करो medicine. Yes. So the remedy is sarsaparilla. These are the basic things, guys. I'm starting with basic. We are going to prescribe on a simple basic explanation. Yes, Rajveer. Sorry, sir. Tomorrow my exam. Please set session tomorrow morning. Yes, Rajveer. Please complete your exam, and then after you can go through our video, our recorded video. So yes, if the aggravation is there in summer, in those cases you can think of typical sarsaparilla, right? Is it mentioned in book? Nikalo. Sarsaparilla that is mentioned. That is aggravation from summer, aggravation from sun, aggravation in spring, if I'm not wrong. So these are the modalities that is mentioned in sarsaparilla. Can anyone read sarsaparilla scheme?
Yes, sir.
Please, Pankti.
Rash from exposure to open air, dry, itch like eruptions, prone to appear in spring and become crusty.
तो spring season कब आती है? Anyone? Spring in India. Anyone? What are the months in which spring occurs?
Between winter and summer, sir.
March, April.
कौन से month है? That is March and April, right? Mid Feb से शुरू होता है, March full and April full. Yes. So these are the initiation or initial time of summer, जहाँ पे summer की शुरुआत होती है. So spring is a part of summer season. तो जब भी initial, we can remember like festival. So जो धुलेटी का फेस्टिवल आता है, तो क्या बोलते हैं उसको? होली बोलते हैं ना, होली. या तो होली का जो फेस्टिवल आता है, इफ पेशेंट इज टेलिंग यू कि मुझे होली खत्म होते ही या होली के बाद या फिर मुझे मार्च और अप्रैल के बाद तकलीफ शुरू होती है या ड्राइनेस बढ़ती है या क्रैक्स होते हैं या सोरियासिस बढ़ रहा है, in those cases you can think of typical sarsaparilla. Yes, please continue, Pankti. कौन पंक्ति रीड कर रहा है ना, प्लीज?
जी जी सर, ये स्किन वाली 2 लाइन ही है सर सरसापरेला में.
ओके,
जी
आपने आगे का पढ़ा कुछ? एक्सट्रीमिटीज, यू जस्ट रीड एक्सट्रीमिटीज.
ओके सर.
Trembling of hands and feet, burning on sides of finger and toes. Guys, we can think of this remedy, sarsaparilla, whenever there is issue related to fingers or if the eruptions are around the nail bed. What kind of eruption is there? That doesn't matter. That doesn't matter at all. But the affinity of this medicine is around the nail and the tip of finger. So just read it out. Burning insides of finger and toes, onchia, ulcer around the end of fingers, cutting sensation under nail, rheumatism, bone pain worse at night, deep raggeds on finger and toes, burn under nail, tender on hand, ulceration around the end of fingers. End of fingers may crack, so ulcer or whatever, you can think of this remedy. Cutting sensation under nail. Along with that, if there is typical sensation like cutting, you can think of this remedy. Another remedy is petro. So now how will you differentiate? If aggravation is in winter, think of petro. If aggravation in spring or in summer, think of sarsa. That is for nails. That is for tip of fingers. And if it is in soles, you can think of this remedy. Even we can think of this remedy in hangnails. जब भी ऐसे छोटे छोटे एलिवेशन होते हैं, दिस इज कॉल्ड हैंगनेल. right? Sometimes it is painful. So in those cases, you can think of this remedy, that is sarsaparilla. Are you with me, guys?
Yes, sir.
Yes,
Yeah.
sir.
आज एनर्जी कुछ कम लग रही है. Are you with me?
Yes,
Yes,
sir.
sir.
हाँ.
Sir.
Yes.
Yes, sir.
हाँ. हाँ, थेरापेटिक में और एनर्जी चाहिए. Yes, another wonderful remedy, the common remedy, that is graphitis. We all know graphitis works excellently in cases of dryness, in cases of cracks. So yes, graphitis have affinity in cases of psoriasis when there is dryness, which is remain whole the year. So in those cases, we can think of graphitis. Graphitis is one the wonderful remedy, and you all know what kind of texture is there in cases of psoriasis, in cases of graphitis. Anyone? Sorry. इसका टेक्सचर कैसा होता है? रफ टेक्सचर. यस, देन
Like a
like
card paper, you told
yes,
something.
scratch paper, that is called as sandpaper. So that is a texture typically like sandpaper. In those cases, you can think of graphitis. Thick skin होती है, dirty skin होती है. These are the common things. But when it is remain whole here, and if we get the typical texture like sandpaper or catch paper in Gujarati, in those cases, you can think of graphitis. Are you with me?
Yes,
Three leading remedy.
Yes, sir.
Yes. Three leading remedy. One is petro, one is sarsaparilla, and one is graphitis. You can give petro in 1 potency every week. You can give sarsaparilla in 200 potency TDS, and graphitis you can repeat every week or even every 15 days. Some homeopaths get afraid to prescribe graphitis, but if the picture is matched, don't afraid to prescribe graphitis. It is going to work.
कितनी potency में sir graphitis?
Graphitis you can give in 1 potency every week
Okay.
or even every 15 days as per needed. Right? One of the excellent remedy which we are using in our practice, that is ars iode, guys. One of my favorite remedy. But when to use it? When there is excessive scaling. पेशेंट आपको बोलता है कि सर मैं सुबह उठता हूं और उठने के बाद बेड के ऊपर स्केलिंग पड़ा होता है. That much excessive scaling is there. In those cases, you can think of ars iode. Can anyone read ars iode scheme? Anyone? Ars iode, skin, dry, scaly, itching. When you have these three trio, you can think of ars iode. So these three thing is always there in cases of psoriasis. So you can simply prescribe this remedy on basis of these three trio, that is dryness, scaly, and the third thing is itching. Right? Marked exfoliation of the skin in large scales. तो बहुत सारी बड़ी बड़ी स्केल होती है, लार्ज स्केल होता है, along with exfoliation. In those cases, you can think of as iode. And leaving a raw exuding surface beneath. मतलब वो स्केल निकल जाती है, उसके पीछे रो या पेनफुल या टच करने पे सॉरनेस सेंसेशन हो, ऐसी स्किन रह जाती है. So in those cases, you can think of as iode. Ars iode is one of the good remedy for ichthyosis. Anyone know what is ichthyosis? What is ichthyosis? Anyone?
Fish scale-like appearance of the skin.
Yes. Dryness is there, but dryness is that much intense. So appearance of the skin is looks like a fish skin. उसका जो texture होता है, when you visit to the desert और desert में पानी नहीं होता है, तो वो desert में जो appearance होता है, that kind of appearance is seen in the skin due to dryness, that is due to internal dryness. and that is the ichthyosis. And in these cases, we can think of as iron, one of the leading remedy for such condition. Enlarged crofulous glands, eczema of breast. So when there is eczema or when there is eruption on the breast, you can think of this remedy. Watery, oozing, itching, washed by washing. So if it is aggravation by washing, you can think of this remedy. There is mentioned psoriasis in the book. In boric, you can think of this remedy. But yes, how you can differentiate arsenic alb from ars iode? Anyone? How you can differentiate arsenic alb from ars iode? Both are ars. So how you are going to differentiate these two remedies in your practice?
Ars iode is hot remedy and ars alb is chilly remedy.
Okay, so you are absolutely right. So I'm little bit modifying it from modalities. If patient is ameliorated by cold application, which is the common modality, like sulfur, which is the common modality like apis. If patient is ameliorated or pain or burning is ameliorated by cold application, in those cases, you can think of arsenic iode. If you feel that patient is arsenical, but modalities are not matches to arsenical, it is opposite to arsenical, in those cases, think of ars iode. And as we all know, arsenic alb is evaluated by hot application, arsenic alb is evaluated by warm application. Even arsenic alb desire for hot food, arsenic alb desire from warm food, so that you can confirm with the patient. आप खाने बैठते हो तो आपको खाना गर्म चाहिए या ठंडा चाहिए? पेशेंट आपको आंसर देगा मुझे तो वो गैस के ऊपर से उतारा हुआ ही खाना चाहिए. दैट हॉट फूड इज डिजायर. मुझे रोटी गरम गरम ही चाहिए. That kind of hot food desire, you can think of arsenic alb. If the symptoms are ameliorated with cold application, you can think of ars iode. Differential remedies में sulfur and differential remedy में apis. Likewise ameliorated by hot drinks, that is related to ars alb, not related to ars iode. So arsenic alb के साथ we are differentiating remedies. Ars alb is ameliorated by hot application. Another remedy, any remedy you know, amelioration by warm or hot application. Pain, burning, anything which is ameliorated by hot application.
Restox.
Yes.
Silesia.
Yes. The leading remedy is Rustox. Guys, remember in your practice, Rustox and ars alb both having very similar modalities with cold, with burning and pain on skin. Are you getting my point?
Yes.
This is how you can differentiate the medicines. आपको लग रहा है कि this is the arsenic alb patient, patient having fastidiousness, patient having anxiety due to psoriasis, patient having fear of death, everything is there. Patient having unquenchable thirst for cold water, everything is there. Hot water, everything is there, but which is ameliorated by cold application. पेशेंट को ठंडे पानी से स्किन के ऊपर अच्छा लगता है. In those cases, you can think of typical our favorite remedy, that is ars iode with excessive scaling. बहुत स्केलिंग होता है. जब भी पेशेंट ऐसा वर्ड यूज करता है, यू कैन थिंक ऑफ ars iode. आपके माइंड में वो क्लिक हो जानी चाहिए. Excessive scaling is there, I can think of ars iode. And you can cross question with the patient about fastidiousness, about anxiety, about thirst, and everything. Right? Another base remedy that we are practicing, yes, ars iode you can prescribe in 200 potency. You can prescribe in 200 potency every week. If required, you can give it in every 15 days. If the itching is intense, if the scaling is intense, you can give ars iode rather than ars alb. But modalities must be matched. and mental picture must be matched. In those cases, you can think of R1M in higher potency. Are you with me, guys?
Yes, sir.
Yes.
So, as I told you, psoriasis ka management is required. How to manage the patient of psoriasis? So, when patient came to you, they already came to you with lots of medication application, lots of oral medication. So when patient came to you, patient आपको पूछेगा कि मैं पुरानी medicine use करूँ या नहीं करूँ. So guys, if patient is already on steroid, patient को बोलो never stop your steroid or your local ointment of steroid suddenly. हमने बहुत सारे पेशेंट देखे हैं जिनका स्टीरॉइड बंद हुआ है, तो that comes withdrawal symptom. तो पेशेंट को फ्लेयर अप होना शुरू होता है और पेशेंट फील्स दैट कि आपकी मेडिसिन के बाद वो बढ़ा है. नो, दैट इज नॉट इंक्रीज ड्यू टू योर मेडिकेशन, दैट इज इंक्रीज ड्यू टू विड्रॉल ऑफ स्टीरॉइड, सडन विड्रॉल ऑफ स्टीरॉइड. सो जब भी आपके पास पेशेंट आता है, पेशेंट इज ऑलरेडी ऑन ओरल स्टीरॉइड और पेशेंट इज ऑन टॉपिकल स्टीरॉइड, तो नेवर स्टॉप दोस स्टीरॉइड सडनली. पेशेंट को बोलो कीप कंटिन्यू विथ योर मेडिकेशन. Along with that, we are going to start our medication. And as it is required, as you are improving, I am going to reduce your external medicine, or I am going to reduce your oral steroids. I am going to taper off your steroids as and when required, but not now. This is not the time to cut off your steroid. Otherwise, withdrawal symptom again, that is going to increase. Disease is going to increase, and patient feels that is due to your medication. So explain them. That explanation is required, especially in cases of autoimmune disease in chronic diseases. Now, हमने आर्स आउट दे दिया, अब क्या? लाइफ टाइम तो आर्स आउट को रखेंगे नहीं. हमने आर्सेनिक आउट दे दिया, अब क्या? अब क्या करोगे? If patient is improving with ars iod, now what? Yes, कैसे करोगे? क्या करोगे आप? पेशेंट नेक्स्ट विजिट में आया, 15 डेज के बाद आया कि सर मुझे अच्छा है, तो क्या करोगे?
Then watch placebo given.
Make a thumb rule. जब भी पेशेंट इज टेलिंग यू कि आई एम इम्प्रूविंग, आपको विजिबली लग ना रहा हो, if patient is improving mentally, physically, in whatever manner, appetite improved, sleep is improved, whatever it may be, if patient is feeling improved, never change your prescription. Believe me. Even don't put your patient on SL. Keep continue your prescription in same manner. If you have already prescribed Arsaud every week, then keep continue Arsaud every week. This is also a session of second prescription. So guys, keep your mind alert. Yes, when patient is telling you I'm improving, so never change your prescription. Keep continue. मैंने बहुत सारे होम्योपैथ्स देखे हैं, मैंने बहुत सारे मेरे colleagues देखे हैं कि what they do, they just stop the medicine. They just put the patient on the SL. So that stimulant which medicine is giving, that is going to reduce. और what happened? एक महीने तक कुछ नहीं होगा. एक महीने तक patient feeling better. लेकिन एक महीने के बाद that feeling of better getting reduced. Or that can be worry. That can be fluctuate. So guys, if patient is telling you I'm feeling better, if you are observing that patient is feeling better, in those cases, never change your prescription. Not even put your patient on SL. Are you getting my point? The first part as a homeopath is there, भाई overdose तो नहीं हो जाएगा. Body is requiring that dose. So no need to change the prescription. कोई overdose नहीं होने वाला. If patient is continuously improving, no need to change the prescription. There is no chance of overdose in cases of potentized medicine. Are you getting my point?
Yes, sir.
Now, if you have already prescribed petroleum or arsenic or arsenica, patient is telling you, sir, I am not feeling better. आपकी दवाई के बाद मेरे पैचेस बढ़ गए. This is going to happen in cases of psoriasis. सब psoriasis के ग्राफ ऐसे ही नीचे नहीं जाएंगे. In cases of psoriasis, mentally as a patient, along with that, you have to be prepared. आपने कोई मेडिसिन दी, उसके बाद पेशेंट को थोड़े टाइम के बाद बढ़ा है, तो never get disappointed. There are lots of triggering factors which we already discussed in last session. So those are the triggering factors and that can trigger to the patient. वो वेदर भी हो सकता है, मेंटल स्ट्रेस भी हो सकता है, एक्सटर्नल स्टिम्युलेशन भी हो सकता है, एनीथिंग. लेकिन that can trigger to the patient and that triggering factor can increase the condition. Now what? If you have prescribed arsenic albuso, if you prescribe netramyl 1 m, 200, 1 m, now what now? How you are going to manage such case? And believe me, that is more important rather than curing the patient. How you are going to manage? क्या करोगे guys, doctors? Yes. Anyone guys from my online session?
Sir, change the potency, increase the potency.
Okay, that is one of the good point. Then any other? Whatever potency, whatever medicine you have used, if patient is improving for some time with the same medication. For example, you have prescribed arsenic 200, and if patient is improving for 2 months, now the case gets stuck. In those cases, you have to increase the potency. One thing that is up to you, that is up to your surety. If you feel that the medicine is correct, if you feel that this is the arsal patient, this is the arsal patient, if you feel that this is the netramyr patient, and if it is not improving with the same potency, now it's time to increase the potency. Now from our side 200, now we are going to prescribe as our side 1 m. Now let's wait for another 1 month. And if patient is not improving with the same medicine with increased potency, in those cases, we need to prescribe complementary medicine. So anti-miasmatic medicines are the best complementary medicine as we learn in our college life. Right? So what are the common anti-miasmatic remedies? Guys?
Sulfur.
Sulfur for which miasm?
Sora.
Sora.
And another remedy?
Meturinum for psychosis.
Medorinum for which?
Psychotic.
Psychotic.
Yes.
Thuja antipsychotic.
Yes.
Thuja.
Puja.
And antisyphilitic.
Syphilinum.
And another remedy.
Syphilinum.
See, we have 6 remedies for 3 miasm. So one is sulfur, that is for Sora. One is Sorinum, that is for Sora. We have 2 another remedy for psychotic miasm, that is Medorinum and Thuja. And one we have 2 remedies, one is Syphilinum and one is Maxol for syphilitic miasm. So guys, when to prescribe such remedy? When patient came to you and patient is telling you, sir मुझे अच्छा नहीं है, लेकिन मुझे खुजली में अच्छा नहीं. If itching is not reducing with our routine prescription, with our routine prescription, patient having not reduced in burning and itching. In those cases, you can prescribe anti-psoric remedy, that is sulfur and sorinum. If patient is chilly, think of sorinum. If patient is hot, think of sulfur. These two remedies are there. Patient having excessive itching in cases of psoriasis or whatever it may be the disease. If patient is not improving with your routine medication in symptom of itching, in those cases you can think of this as a anti-miasmatic remedy, as a complementary remedy. Are you with me?
हेलो सर।
Yes, doctor.
सर अगर एक्जिमा पे भी ज्यादा इचिंग हो तो सोराइनम दे सकते हैं क्या? चिली पेशेंट रहेगा तो?
Definitely they say. Definitely. Any disease, when you have prescribed your remedy and if you get stuck with potencies, now it's time to complement it. And that is the best complement in cases of itching, in cases of burning, sulf and sorinum.
जी सर।
If patient is chilly, think of sorinum. If patient is hot, think of sulf. And believe me guys, sorinum and sulfur are complementary to each other. So when you already prescribe sulfur in cases of hot patient, if you still get stuck with sulfur 1 m, if you prescribe 10 m, if you still stuck with the sulfur 10 m, give sorinum as a complement. Sorinum is complementary to sulfur and sulfur is complementary to sorinum. So if you already prescribe sorinum 1 m, you have increased the dose, that is the sorinum 10 m, and if you get stuck, simply prescribe sulfur. At that time, no need to check for that thermal. This is how we clinically use such medicine. We all know theoretically so many criteria are there, and we just get stuck, we just get confused in that criteria. Right, guys? This is the simple way what we have developed in our practice, and it works, guys. As I told you, I'm the laziest person, so I always learn from lazy person. So you will definitely get to learn the easiest way. Yes, Dr. Varsha, one question is there from Varsha. सर क्या सल्फर हाई पोटेंसी में दे सकते हैं टेनम में सोरियासिस के केस में? यस वर्षा, क्यों नहीं दे सकते? I always counter question when you get stuck in higher potency. Aggravation का fear है that you have to come out from it. नहीं होगा, believe me. I'm not getting result in sulfur 30 and 200. I'm getting result with 1 m and 10 m. So when you are prescribing as a complementary remedy, always use as a high potency. When you think of this remedy as an anti-miasmatic remedy, always prescribe in high. Your first thought must be 1 m. Then you can gradually increase. You can start with higher potency. Then and then it's going to help you. This is our personal clinical experience. That is, I'm going to share with you. That is, I'm sharing with you. When there is excessive thickness on the skin in cases of psoriasis, आपने बहुत सारे psoriasis के पेशेंट जो देखे होंगे कि जिनके स्किन के ऊपर या एल्बो के ऊपर एक लेयर सी जम जाती है, and that layer is not going to out, that is not going to destroy due to excessive scaling. Excessive thickness of the skin is there. In those cases, you can think of medorinum and as a complementary remedy, these two remedies. When there is thickness on the skin, especially in cases of psoriasis, when scaling gets stuck, when scaling is stuck on that particular part. In those cases, you can think of medorinum and you can think of thuja. Yes, Varsha. Yes, one question from Saumina. Repetition of higher potency. We are generally prescribing higher potency in 1 m every week. If it is required, we are going to increase it. So every day भी देते हैं if required, लेकिन you can just start with every week, right? Higher potencies में 1 m में 10 m में every week prescribe करो. Yes, when you are going to think of thuja, believe me guys, when there is scaling, extra growth of skin is seen on the cases of psoriasis, you can think of thuja as a complementary. You can think of meadow. Meadow where? When there is forgetfulness. When there is hurriedness like argentum nitricum. Time passes too quickly. बहुत जल्दी जल्दी टाइम पसार होता है. Any other remedy you know? Time passes quickly. One is argentum nitricum, one is medorinum, and any other remedy, guys? Time passes quickly. And time passes slowly. We have two remedies, two kind of remedies. Patient is hurried and worried. So in those cases, time passes too quickly. We can think of another remedy. So medorinum and argentum are time passes too slowly, not quickly. Himanshi, I was wrong. Argentum and medorinum and even caladium having time passes too slowly. And cocculus eye having time passes quickly. Let's confirm now. Argentum निकालो. Argentum में क्या लिखा है? Cocculus eye में क्या लिखा है? Time passes too quickly. Yes. Now medorinum निकालो and one कोई argentum निकालो.
Medorinum में time passes too slowly.
That is slowly.
Bracket में cannabis indica and argentum nitricum.
So I was confused. Yes. Argentum निकालो. Let's confirm it.
Time passes slowly.
किसमें? Argentum में.
Yes, sir.
Yes. तो argentum, medorinum, and cannabis indica. Three having time passes slowly. Three remedies. हाँ वो hurried होते हैं इसलिए time slowly निकलता है. Yes. तो argentum, medorinum, and caladium. Three remedies having, sorry, cannabis indica having typical time passes slowly. They are hurried and worried. And another remedy, that is cocculus eye, which is opposite to these three remedies. Clear, guys?
Yes.
Yeah. So when time passes too slowly, in those cases, you can think of medorinum as a complementary. When there is forgetfulness, in those cases, you can think of medorinum. Extra growth, extra thickness of the skin is there, you can think of the. Right? And another, that is anti-syphilitic remedy, we have syphilinum and we have moxo. When there is discharge, as we already discussed, pustular psoriasis. As we discussed the type of psoriasis. When there is pustules is there, in those cases, you can think of moxo. If the pus is yellow, if the pus is offensive, कई बार ऐसे पेशेंट आएंगे कि उनके पस निकल रहा है और पस, even that offensiveness you can feel when patient is already sitting in examination in waiting room. That much intense offensiveness is there. You can think of this remedy, that is moxo. From the offensiveness, we have wonderful three remedies. Anyone knows any remedy for offensiveness? According to Kent, trios of offensiveness. Sorry. Hearing.
Maybe sepia and
Trios में, if I am not wrong, Muxol is there, Baptisia is there, and creosote is there. But in our practice, we always think of pyrogen, we always think of Muxol, and we also think of Sorain. When there is excessive offensiveness, these are the remedies you can think when there is offensiveness. These all 6 remedies: creosote, Muxol, pyrogen, Baptisia, this Sorainum, these 5 remedies for offensiveness. So if the pus is there, if it is offensive, think of all these remedies. If pus is there which is in yellow color, think of Muxol. If the pus is there which is in white color, think of Sorainum. And yes, if the destructiveness is there, see, all 3 miasms are covered in cases of autoimmune disease. All 3 miasms are covered in cases of any chronic disease. What kind of symptom we have in our case, that is important. What kind of symptoms matches with our remedy, with our miasm, that is important. So if destructiveness is there, if patient is destructive, in those cases you can think of syphilis. These are the best intercurrent remedy in cases of psoriasis. Now, when you prescribe intercurrent remedy, what next? For example, you have prescribed sulfur 1M after ars iode. Simply prescribe sulfur 1M and now it's no need to repeat it. Now come back to your routine prescription. सल्फर ने धक्का दे दिया, सैंपल ने पुश कर दिया, उसने पोक कर दिया. Now it's time to work by our routine medication. This is how we practice in our clinical thing. Don't make it confused. Don't make it confusing. बहुत सारे criteria है. We all get confused in our initial practice, but this is how you can simply prescribe remedies. We have a wonderful remedy, that is Antium crude. When there is case of psoriasis, along with patient is suffering from gastric issues like acidity, like gastric complaints, like irritations, like burning in abdomen, burning in stomach, distended abdomen with constipation, such thing. Gastric complaint associated with psoriasis or associated with any skin disease. You can think of Antium crude. Antium crude, you can identify from symptoms. Those are, anyone? How you can identify this is the Antium crude? Anyone? What are the criteria to identify Antium crude in practice? Or what are the modalities? What are the desire? What are the aversions of Antium crude? Anyone? Yes, Richa. Pickle desire, absolutely right. See guys, there is desire for sour. खट्टी चीजें पसंद आती है. So what are the things which covered खट्टी thing? Which includes sour thing? Which having sour taste? What are the routine diet thing? Anyone?
Achar,
Achar, that is pickle. Then that is already mentioned in book. So any other thing which is sour? One is girls' all favorite, that is pani puri, golgappe. Golgappe having typical khatta taste. So when patient having desire for khatta, you can confirm it. सब पेशेंट आके नहीं बोलेंगे कि मुझे एसिड और पिकल्स पसंद है, राइट? पेशेंट को सॉर डिजायर है, खट्टा पसंद है. Even Chinese food having that vinegar, and that is desire for patient. Yes, पेशेंट बोलेगा मुझे कच्चे इमलिया खाने की इच्छा होती है, पेशेंट आके बोलेगा मुझे कच्ची कैरी खाने की, मैंगो खाने की इच्छा होती है, रो मैंगो, पेशेंट आके बोलेगा मुझे लेमन चूसने की इच्छा हो रही है। दोस आर द डिजायर फॉर एंटीएम ग्रुप्स, खट्टा खाने की इच्छा होना। फ्रॉम दैट पॉइंट यू कैन थिंक ऑफ एंटीएम। Even the leading remedy of antium, leading symptom of antium crude is aversion to bathing, like sulfur. When I'm prescribing antium crude, I always confirm it with the patient, especially in pediatric patient, confirming with parents. वो winter में नहा के जाता है स्कूल? If they confirm it कि हफ्ते में 2 ही बार नहाता है या हफ्ते में 2 बार ही स्कूल नहा के जाता है, that is your deep prescription is in skin eruption, along with gastric issue, desire for sorting, and aversion to bathing. If you get such thing, if you match with your patient, simply prescribe antium. No need to think about any other. Sour desire, sepia is also there. But when you match such thing, never think of any other. Are with me with antium crude? Guys,
Yes.
Yes, sir.
yes. So, in cases of psoriasis, when there is cracks, when we are talking about plantar or palmar psoriasis, there are cracks. So we all know, we already discussed petroleum, graphitis, and sarsaparilla for cracks. But when there is a deepest crack, the cracks in the soles are very deep. In those cases, what remedy we can think of, guys? Anyone? But dad always used to tell me the deepest
X-ray.
crack of materia medica. Yes, Richa, you're absolutely right. That is X-ray. When there is deep crack, patient को इतना deep crack है in soles. If it is psoriasis or simple cracks in soles, whatever, इतना deep crack है. Believe me, simply prescribe X-ray in 200 puttings and share your experience with. It is definitely good. Yes, Rustox, or one of the good remedy, we all know, we are prescribing Rustox in droplet psoriasis, that is gutted psoriasis. क्योंकि that is raindrop psoriasis, उसके अंदर vesicles होते हैं. So vesicles are in very small size, तो vesicles के साथ जब eruptions आते हैं, in those cases we can think of Rustox. छोटे छोटे पानी भरे हुए या विदाउट पानी, if it's there you can think of Rustox. तो gutted psoriasis के लिए the specific remedy is Rustox. Modalities must be matched. Damp weather aggravation. Along with that, if patient is evaluated with warm application. Patient बोलेगा मैं गोवा जाके आया हूँ और उसके बाद मैंने जो वहाँ पे स्नान लिया है या गोवा के अंदर मैं बिकिनी पहन के बीच पे जो गई हूँ उसके बाद मुझे सोरियासिस बढ़ गया. In those cases, you can think of Delcamara and you can think of Rustox. हाँ, ऐसे पेशेंट आते हैं. These are the triggering factors. Rustox, you can definitely think of Rustox. You can give 30 potency TDS. When I'm talking about gutted psoriasis, that is commonly seen in pediatric patients. So in that cases, we can, with the infection of throat, with the history of sore throat, with the history of streptococci infection in throat, that is called a strep throat. So in those cases, we can think of streptococcinum. When there is history of streptococci throat, or uske baad, if there is aggravation of psoriasis, we can think of the remedy, that is streptococci. When I'm talking about goutte psoriasis, when I'm talking about droplet psoriasis, in those cases, you can think of wonderful remedy in pediatric eczema or pediatric psoriasis, whatever it may be the condition. Our favorite remedy is viola tea. If the eczema or psoriasis is on scalp, this is the specific remedy. But if it is in all over body, in pediatric cases, you can think of this. Psoriasis scalp में this specific remedy is violet tea, especially in cases of pediatric. Another specific remedy that you all know for psoriasis scalp is anyone? Anyone? Psoriasis scalp. Be specific remedy. Eczema on scalp. Any remedy you know that it has a typical affinity on scalp.
Meserium.
Yes, Dr. Rajitha and Dr. Rajat, you're absolutely right. The remedy is meserium, guys. Meserium having typical affinity on the scalp. Can anyone read meserium?
Eczema, intolerable itching, chilliness with pruritus, warts in bed, ulcer, itch and burn, surrounded by vesicle and shining, fiery red areola, herpes zoster with burning pain, bones, especially long bones, inflamed and swallow, carries
वापिस long bone का क्या है?
bones, especially long bones, inflamed and swollen.
आगे. Zone with burning pain, bones, especially long bones, inflamed and swollen, carries exostosis. So, जब भी skin eruptions are there on long bone, तो long bone कौन से है?
Femur,
Tibia.
Humerus, tibia. So if the eruptions are at the skin of tibia, see, this is the location. This is the location. I'm not afraid to share you the location. This is the location. If you get any eruption over here, you can think of meserium. This is the location of meserium, skin of tibia. Guys, any kind of eruption. If it is eczema, it is psoriasis, whatever. You can think of this remedy. That is meserium. Please continue, doctor.
pain, warts, night, touch, damp weather, eruption, ulcerate, and from thick scabs under which purulent matter is exuded.
Perfect. Please read head now.
Hard work to talk, headache, warts from talking, stupefying headache on the right side, affection of the external head, scaly eruption, white scabs, head covered with thick lethargy crust under which pus collects, crustal ectasia, violent neuralgia around the face and teeth, extending to the ear at night, warts eating, better, near hot stop, roots of teeth decay, teeth feel elongated.
Yes. So guys, scalp is covered with crust. That is the indication of psoriatic scalp. That is also seen in cases of seborrheic dermatitis. So whatever the condition, seborrheic dermatitis or psoriasis, we can think of meserium. और जब भी आप scratch करते हो, in those cases, you will feel the pus inside. Let me check the photos. If I get, yesterday I got a patient having typical meserium eruption. Imagine. Rajat, you joined already? You share karo. मैं लैपटॉप में से शेयर कर. See, is it visible, guys?
Yes, sir.
Yes. These kind of thick crust are there in cases of mesothelioma. Is it yellowish crust? In those cases, you can think of kali sulf. If it is in yellow, जब भी पेशेंट बोले कि मुझे येलो स्कैनिंग हो रहा है, मुझे येलोइश पोतरियां निकल रही है, इन दोस केसेस यू कैन थिंक ऑफ काली sulf along with mesarium. See, this is completely visible in this thick yellowish scales. See, is it visible, guys? This is
Yes,
the
yes,
case.
sir.
This is the case of mesarium. I hope your photo देखने के बाद you are not going to forget such condition. That is why I am showing you such photo. जब भी whenever you get such scaling, now it's completely visible.
Yeah.
You can even pick up. So this is the condition of mesarium. Scaling होता है और scaling के अंदर when you scratch it and this pus formation निकलता है. If it is there, think of mesarium. Are you getting my point, guys?
सर उसमें से
Sorry.
सर उसमें से ब्लड निकल रहा हो तो कौन सी मेडिसिन दे सकते हैं?
आवाज कट हो रही है डॉक्टर आपकी.
हेलो,
हाँ जी बोलो.
हाँ सर उसमें से ब्लड निकल रहा हो तो कौन सी मेडिसिन दे सकते हैं?
Not audible.
सर वो कह रही है अगर ब्लड आ रहा हो तो कौन सी मेडिसिन?
ब्लड आ रहा है तो भी मेसेरियम दे सकते हो. That is the key of psoriasis. When you scratch the scalp और अंदर से ब्लड आ रहा है तो that is the auspicious sign. तो ब्लड आ रहा है तो even in those cases you can think of this remedy. That is mesarium. लेकिन पस है that is the confirmed prescription. काली सल्फ भी दे सकते हो. You can even think of senicula. निकालो senicula. Senicula also having the excessive scales on scalp. Oh, pimple-like eruption, painful while combing in scalp, what to give and what to tell patient. Yes, Samina, that is boil, that might be acne, which also can occur on the scalp. So arsenic works excellently in those cases. Bolo patient, that is acne or boil. Senicula, there is mention in head of downward motion, profuse sweat on occipital and nape of neck and during sleep. Anyone knows from where this senicula prepared? किसमें से बनती है? From which substance is it prepared?
Spring water.
कौन सा spring water? कोई भी? ये
The water of
उदयपुर में,
Himalayan.
ये राजस्थान में उदयपुर में बहुत स्प्रिंग हो जाते हैं, या महाराष्ट्र में एक कौन सा खंडाला है वहां पे बहुत स्प्रिंग हो जाते हैं. तो कोई भी स्प्रिंग में से guys, which spring? That is mentioned in Puri. The water of Senicula spring, that is the particular Senicula spring which is located at Ottawa. So Ottawa is located at, anyone? Anyone? Nowadays people are crazy to go Canada. जो कन्नडा जाने की प्लानिंग में है उनके लिए this spring is there in Canada. There's Ottawa near Ontario. So this is the specific जो spring है, springs है, वहाँ पे उनके water में से ये बनाते हैं medicine. So there is now a question mark that spring is nowadays not available over there, which is dried out. वहाँ पे नहीं है. There is still a question mark कि वो कहाँ से बनती है. They have companies have the back potencies. लेकिन वो कब तक चलेगी वो भी हमें पता नहीं है. So yes, Senicula is prepared from the Senicula spring, which is located at Ottawa, or see, it is prepared from that water. तो उसमें सिलिसिया के भी सिम्टम आएंगे, उसमें कैलकेरिया के भी सिम्टम आएंगे, उसमें कैलकेरिया फ्लोर के भी सिम्टम आएंगे, उसमें कैलकेरिया फॉस के भी सिम्टम आएंगे. All minerals are there in such springs, right? So Senicula having typical perspiration like calcarea. See, read it. Profuse sweating on occiput and neck during sleep. That is typical perspiration of calcarea. And that kind of excessive perspiration also seen in Cilicia. So this medicine covered such kind of symptoms. So back to our topic, that is lacrimation in cold air and from cold application, profuse scaly dandruff. That is excessive sebaceous secretion and soreness behind ear. So in those cases, when you get excessive scaling from the scalp, you can think of this remedy, that is Senicula. Dirty, greasy, brownish, wrinkled skin, eczema, fissures, hand and fingers like petroleum and graphite. See, these are also minerals. So minerals के बहुत सारे symptoms which are covered by this. Are with me? Even this is one of the best remedy for constipation in pediatric patient. When parents are coming to you and telling you, sir, एक दिन छोड़ के एक दिन stool हो रहा है, in those cases, you can think of Senicula. Let's read it out. Stool hard, heavy and painful, pain in whole perineum, no desire until large accumulation, after gray stain only partially expelled, resides, crumbles at verge of anus. Another remedy is Magmure. So these two remedy works excellently in cases of constipation in children, constipation in pediatric patient. तो Magmure, when there is sheep's duct कैसा होता है? Stool of sheep कैसा होता है, guys? Anyone? We just read in our Materia Medica, but you really know what is that? How you can clinically diagnose sheep's duct?
स्मॉल रहता है, सर्कल
Small balls, small balls.
Small balls, लेकिन black होते हैं, or that is hard. Even you can play with those balls like marble, guys. जितने भी विलेज में पैदा हुए या विलेज में खेले, they know it. You can play with those balls like marbles. That hardness is there. That hardness is seen in Magmure. Sheep's duct. Sheep के stool के जैसा black color, round, hard stool आता है. That is Magmure. And especially you can prescribe in orphan children. Especially you can prescribe this medicine on orphan sensation kind of वाले बच्चे. कैसे बच्चों में orphan feeling होती है? Anyone knows? Anyone feel that situation in any patient? 4-second feeling. तरछोड़ाइली feeling. Orphan feeling.
में
Sorry?
बड़े भाई में, फैमिली में सबसे बड़े भाई होते हैं उनको.
Exactly. जब छोटा बच्चा आता है, जब another sibling आता है family में, and when that is the situation of first child, when the second child birth, jealousy भी होती है, that you can think of like a cease. लेकिन जब भी ये 4-second feeling आती, अब पूरे फैमिली का फोकस छोटे बच्चे पे है. तो बड़ा हो गया है, he is mature, उसको कुछ करने की जरूरत नहीं है, उसको कुछ हेल्प करने की जरूरत नहीं है. That kind of feeling is there in family. वो गलत भी नहीं है, लेकिन when the child is feeling like that, you can think of this remedy. That is Magmure, and another remedy is Macab. Macab and Magmure having typical affinity in GI tract. So when there is diarrhea with such feeling, you can think of Macab. Even you can think of Macab in lactose intolerance. Even you can think of this remedy in celiac disease, when there is intolerance to that lactose. So if constipation is there, think of Magmure. If diarrhea is there, think of Mecca. Along with that, you can think of Seniculia for constipation, and Seniculia is the best remedy for scalp psoriasis. Are you with me, guys?
Yes, sir.
Yes. Yes. Now, in cases of psoriasis scalp, there is quite differentiating point between psoriasis scalp and seborrheic dermatitis. So when the eruptions are coming out from the margin of hair, आपके पास psoriasis वाले पेशेंट आएंगे, उनको कान के पीछे margins of hair के पास eruption है. So when there is eruption of psoriasis at the margin of hair, कौन सी मेडिसिन दोगे guys?
Netramute.
Netramute is the leading remedy. Any other remedy? Anyone?
Sepia.
I don't know about sepia, but that might be. Any other remedy? We have three leading remedy for eruption at the margin of hair. One is Netramute, one is oleander, and one is clematis. Three leading remedy. Eruption at the margin of hair. Let's read Netramute first. Is it mentioned in book Netramute, guys? Can anyone read skin from Netramute? As we all know, the face of Netramute is typical greasy oily face. So greasy, oily, especially on hairy part, dry eruption, especially on margin of hair, hairy scalp and behind the joint. So joint ke behind, that is occiput, that is the folds of joint. So this is the cuboidal fossa and popliteal fossa. If eruptions are there, you can think of Netramute. And if the eruptions are at the margin, this is the margin, guys. If patient having eruption at the margin, psoriasis वाले बहुत patient आके बोलेंगे कि सर मुझे यहाँ पे eruption है, मुझे यहाँ पे, I have eruption over here. So these are the margins of hair. In those cases, you can think of Netramute. Crusty eruptions in bend of limbs, margins of scalp, and behind the ear. We are going to discuss about the remedies behind the ear. Again, let's discuss at the margin of hair. Another remedy is oleander. Nikalo. Oleander having eruption behind the ear. जब भी आपके पास पेशेंट आए having eruption behind the ear or psoriasis behind the ear, in those cases you can think of these three remedy. One is petroleum, one is oleander, and one is graphitis. These three remedy, guys, believe me, works like anything in cases of eruption behind the ear. We're talking about the margins of hair. So yes, oleander, head, vertigo, diplopia when looking down, vertigo, eruption on scalp, humid, fatted spot behind the ear. So as I told you, behind the ear, no oleander. Another two remedies, that is graphitis and petroleum, and on occiput with red rough herpeting spot in front, corrosive itching on forehead and edges of hair. That is the margins of hair, worse by heat. So when the eruptions are on occipital region, when eruptions are at the margin of hair, and when the eruptions are behind the ear, in these three locations, you can think of the remedy that is oleander. Another remedy we have that is clematis. निकालो clemati. निकालो. निकालो बोलने में मजा आता है. Yes. Red skin. I'm talking about clematis skin. Red, burning, vesicular, scaly like psoriasis, scabby, itches, terrible, बहुत खुजली होती है. Worse, washing in cold water. See, इसमें cold water से aggravation हो रहा है. And when I'm talking about oleander, तो oleander में heat से wash हो रहा है, गर्म चीज से बढ़ता है तो think of oleander, और ठंडी चीज से बढ़ रहा है तो think of clematis. Both having same locality, affection of locality. Wash face and hands and scalp around occiput. So both having eruption on occiput, glandular induration and tumor on the breast and varicose ulcer. So both having eruption on the occipital region. So now how will you differentiate occipital region ki eruption, oleander and clematis? When the eruption are dry, think of oleander. When the eruptions on the occipital region are wet, like pustules are there, when pus formation is there, watery discharge is there, if it is moist, in those cases, think of clematis, which is mentioned in Fatak repertory. हेड के अंदर मेंशन किया है फाटक मटीरिया मेडिका. हेड के अंदर कंफ्यूज फीलिंग एमिलेशन ओपन एयर, eruption on occiput at the base of hair, moist, pustules, sensitive and itchy. That is mentioned in Patak. Are you with me, guys? These are the basic differentiating point between the remedies. So when you get eruption, you can differentiate those remedies from each other. Any question, any query till now, guys? We are frequently using this remedy. These are the excellent remedies. Believe me, guys, that works like anything.
Sir, in scalp psoriasis, violet tea and mesareum doses and repetition potency.
Mesareum and violet tea, as those are specific remedies, you can prescribe in 30 or 200 potency TDS. We are giving in TDS form. 2 to 2, 3 times a day. Even you can think of psorinum as a complementary. You can think of medorinum as a complementary in cases of psoriatic scalp. We have a wonderful remedy that is hydrocotyle, that excellently work in cases of psoriasis when there is palmar and plantar psoriasis. Open hydrocotyle. Can anyone read skin from hydrocotyle?
Dry eruption, great thickening of epidermoid layer and exfoliation of scales, psoriasis areata on trunk and extremities, palms and soles, pustules on chest, circular space with scaly edge, intolerable itching, especially of soles, profuse sweat, syphilitic eruption, acne, leprosy, elephantiasis, lupus non-extant.
So any kind of eruption having great thickening, skin thick, like antium crude, like thuja, in those cases you can think of this remedy. कहाँ होते हैं eruption? That is on trunk, that is on extremities, that is on palm, and that is on soles. Pustules on chest के ऊपर pustules हो, even you can think of this remedy. Circular spot with scaly edge, that is tinea infection. So in those cases, you can think of this. Intolerable itching, सर बहुत खुजली आ रही है, कुछ कंट्रोल नहीं हो, especially in soles, that is mentioned in boric. You can think of this. Along with that, profuse sweating. You can think of that. Yes. We have another remedy, that is malandrinum. Hello, malandrinum. मेलेंड्रिनम एक छोटी सी मेडिसिन है, लेकिन बहुत अच्छी सी मेडिसिन है. So you can think of malandrinum. Cap on upper lip with stinging pain when torn off, aching in forehead, dry, scaly, itchy, ragged of hand and feet in cold weather and from washing. Toes feel scalded and itch terrible, bone-like protuberances. तो जब भी वॉशिंग या फिर पानी में ज्यादा काम करने की वजह से सोल्स के अंदर थिकनेस होती है या स्केलिंग होती है, इन दोस केसेस यू कैन थिंक ऑफ मेलेंड्रिनम. You can give this medicine in 200 potency. You can give this medicine in 100 potency. This is one of the good medicine when aggravation or ailment after vaccination. One is thuja, one is silesia, and third is malandrinum. These are the three leading remedy ailment after vaccination. बहुत सारे पेशेंट आएंगे कि जिनको कोविड की वैक्सीन ली है या और कोई वैक्सीन ली है जिसके बाद इरप्शन या एग्रावेशन हुआ है. यू कैन थिंक ऑफ दिस. कोई भी सोरियासिस का पेशेंट हो, खुजली तो होने ही वाली है, लेकिन व्हेन यू गेट अ पेशेंट ऑफ सोरियासिस हैविंग नो इचिंग, दैट इज सोरियासिस विदाउट इचिंग. कौन सी मेडिसिन है गाइस? Each and every patient of psoriasis having itching. That is the common symptom of psoriasis. But what is peculiarity? When patient came to us with psoriasis having no itching, that is the key not for us. That is peculiar in this case. In that case, you can think of cuprum aceticum. Yes, Richa Patel, absolutely right. The remedy is cuprum aceticum. That is mentioned in book. Leprous like eruption without itching over whole body and spots of various sizes. So when you search in our repertory, so when you search psoriasis without itching, you will get such remedy, that is cuprum aceticum. It is written in Fatak somewhere. Eruption over whole body in spots of various size without itching. And in chronic psoriasis, that is also mentioned in that. So when there is patient having psoriasis without itching, think of cuprum aceticum. Now patient come to you having eczema without itching. What remedy you are going to use? Eczema without itching. Eczema is generally present with itching. But when patient came to you having eczema which is not associated with itching, in those cases, what medicine you are going to use?
Uva Ursi, I think.
Which one?
Uva Ursi, maybe.
उवा उर्सी में मैं आ रहा हूँ, लेकिन that is not उवा उर्सी. Eczema without itching is Secudavi. That is mentioned in book. Open निकालो बोरिक. Cicuta V. Skin के अंदर first line, that is first sentence, that is eczema, no itching. So eczema without itching is there. In those cases, you can think of this remedy.
सर प्लीज भानी जी का म्यूट कर दीजिए, बीच बीच में डिस्टर्ब हो रहा है।
डेफिनेटली मैं उनको म्यूट कर रहा हूँ। Done. So yes, Cicuta V, eczema without itching. और पंक्ति आपने कौन सी बताई थी मेडिसिन?
maybe हुआ उर्सी.
हाँ, so निकाल हुआ उर्सी. हुआ उर्सी is medicine having urticaria without itching. So urticaria is always present with itching. But when patient came to you कि सर मुझे swelling हो जाता है, सर मुझे उपस जाता है, मुझे रेडनेस हो जाती है, मुझे बम्स हो जाता है, मुझे हाइव्स हो जाता है, लेकिन खुजली नहीं आती. So in those cases, you can think of uva ursi. Open uva ursi, guys. Uva ursi is prepared from beerberry. We are using this uva ursi for external application to reduce the hyperpigmentation. We are going to discuss such part in our next sessions. But yes, when we are talking about potentized medicine, so uva ursi having last line, that is in introduction, that is urticaria without itching. So we have three remedy now. Psoriasis without itching, eczema without itching, and urticaria without itching. कौन सी medicine है? Can anyone repeat? Cupramaceticum is psoriasis without itching. Cicuta V is from eczema without itching. And uva ursi for urticaria without itching. That's it. Clear? Now कहानी में twist. Itching without eruption. मतलब पेशेंट को खुजली आ रही है लेकिन इरप्शन नहीं है.
डॉलिकोस.
One of the leading remedy, that is dolichos. But when you search in repertory, you will also get iodinum, you will also get arsenical, you will also get mesaenium, and you will also get sorinum. These are the leading remedy for itching without eruption. कैसी कैसी कंडीशन में ऐसा होता है? विंटर में पेशेंट को ड्राइनेस है, तो ड्राइनेस की वजह से इरप्शन क्रिएट नहीं हुए हैं, although patient having itching. In those cases, you can think of these remedies. Patient is suffering from hypothyroid या hyperthyroid, उसके साथ साथ patient having dryness of skin, and उसकी वजह से patient is suffering from itching. So you will not get eruption on the skin, although patient is suffering from itching. In those cases, you can think of these remedies. And dolichos कहाँ prescribe करनी है, guys? Anyone knows? Indication of dolichos, especially itching without eruption.
Liver affection, sir.
Yes, that is in liver. So जब भी jaundice होता है, jaundice के अंदर bilirubin are deposited on the skin. In those cases, patient having itching on the skin. In those cases, believe me, guys, dolichos works like anything. That is itching without eruption. Are you with me, guys? Any query, any question till now? Psoriasis के यस डॉक्टर बोलिए। सोरियासिस के बहुत सारे पेशेंट आएंगे जिसमें रिकरेंस बहुत होगा, तो ट्राई टू फाइंड आउट द ट्रिगरिंग फैक्टर. If the mental cause is there, you have to counsel the patient. Counseling is required. पेशेंट को योगा बोल सकते हैं, पेशेंट को प्राणायाम बोल सकते हैं. You can give advice to the patient. Yes, Isa, what is your question? Sir, please answer my message. कहाँ पे आपका मैसेज ईशा? Yes. Sir, can you tell me any medicine for eruption on cuboidal fossa after taking Ayurvedic medicine or some specific sabji like fenugreek? Okay. I don't know कि मेथी के बाद कोई डिसीज होता है या आयुर्वेदिक के बाद होता है, लेकिन I know the medicine which works on cuboidal fossa or popliteal fossa, that is on folds. So Isha, you can prescribe manganic aceticum. Nikalo guys. Manganic aceticum, you can think this remedy when there is eruptions on fold. You can think of petroleum, you can think of graphitis, you can think of lycopodium, and you can think of nattermute, along with manganic aceticum. Having eruptions on folds, having eczema or eruption or psoriasis on folds. It's manganic. Anyone got that remedy?
Yes, sir.
Please read skin.
Sir, suppression of skin around joints, red elevated spots, itching, better scratching, deep cracks in bends of elbows, etc. Psoriasis and pityriasis, burning around ulcer, chronic eczema associated with amenorrhea, worse at menstrual period or at menopause.
Okay. मेंसेस के टाइम बढ़ता है, मेनोपॉज मतलब क्लाइमेट्रिक एज में बढ़ता है. उसके इरेप्शन की एफिनिटी है क्रॉनिक एक्जिमा एसोसिएटेड विद एमेनोरिया. एमेनोरिया के साथ जो होता हो तो यू कैन थिंक ऑफ psoriasis and pityriasis. Deep cracks in band of elbows. Isa, for your patient, you can think of this remedy. Deep cracks or eruption on band of elbows. This is the specific remedy. Itching better by scratching. Okay, guys. Any question? Any query?
Sir,
Patient pemphigus vulgaris come. So what to tell and how to explain?
We are going to take a whole session on pemphigus vulgaris. But yes, as you asked me, pemphigus vulgaris is the autoimmune disease. It takes time to get cure as it is autoimmune disease. So gradually change आएगा. So if patient is on oral steroid or on topical steroid, तो वो use करते रहो और उसके साथ साथ और medication start करो, and then if it is reduced, then you can tap out of the steroid.
एलोपैथी से उसको क्योर तो हुआ पर रीअकर.
That is
So
not
patient
cure.
is it's not cure, but patient से क्योर हुआ. पेशेंट तो यही कहता है अच्छा हो गया पर वापस हुआ.
As there is autoimmune disease, so autoimmune disease आप होम्योपैथी से ट्रीट करो, आप सोरियासिस से ट्रीट करो, या फिर आप सॉरी एलोपैथी से ट्रीट करो या आयुर्वेदिक से. लाइफ स्पान होते हैं. सी when you are treating the patient in the teenage, when you are treating the patient of autoimmune disease in childhood, तो वो जब एक लाइफ स्पान में एंटर हो रहा है, टीनेज में से एडल्टहुड में से नियर टू 40 के बाद मेनोपॉजल एज, उसके बाद जब ऐसी लाइफ स्पान आती है तो उसके बाद ये ट्रिगर हो सकता है. यू कैन एक्सप्लेन टू द पेशेंट. कोई भी ऑटोइम्यून डिसीज, नेवर से कि होम्योपैथी से वो क्योर ही हो जाएगा. I have seen many few cases in my life which get completely cured with homeopathic medicine. Definitely, psoriasis can managed very easily with our medication. That can be under control with our medication. In when you are using cure, so patient को 10-12 साल के बाद भी नहीं होना चाहिए. That is not the terminology. That can be under control. That can be get relief in the symptom. पेशेंट को ठीक हो जाता है, 3-4 साल तक भी कुछ नहीं होता है, लेकिन when life span is there, like stages are there, that can be triggered. That can be. I'm not telling you हर एक पेशेंट को होता है, लेकिन हो सकता है. So be ready. Don't get frustrated when reoccur is there. Keep changing the remedies. Keep finding the modalities. Keep finding the triggering factors. Try to find out some specific modality. Try to find out some complementary remedy that helps in our case. As we all know, each and every case is different in homeopathy. Abdominal pain वाले 10 पेशेंट आएंगे, 10 की मेडिसिन अलग हो सकती है. So medicine can be anything from these 3000 remedies या 4000 remedies. कुछ भी हो सकती है, लेकिन these are the common remedies which gives result in day-to-day practice. Are you with me? Any question, any query?
सर
Yes, Pankti.
सर सोरियासिस मेरे मामा को दोनों बायलेटरल एल्बो जॉइंट पे है.
See, when we are talking about bilateral, तो एक आर्निका का थॉट आता है, लेकिन in cases of psoriasis, bilateral eruptions are common. I have observed it, that arnica is not helping much. Right? If eruption are eczema or if eruption are some another thing which are not in similar way, which are not bilateral in their routine form. If they see bilateral, you can think of arnica. Pankti.
सर और कोई मेडिसिन एल्बो जॉइंट स्पेशली उस
जॉइंट
पे
के
है?
ऊपर दी स्पेसिफिक रेमेडीज तो मेजोरियम नेट्रोम्यूर तो है ही, लेकिन दी स्पेसिफिक हैव टू सर्च फॉर इट because those are the common locality, common affection of psoriasis. So I'm not practicing on that way कि भाई elbow के ऊपर है तो in psoriasis I have to prescribe. लेकिन that is
जी
the
सर.
common location. That is the common location of psoriasis, especially यहाँ elbow के पास होता है या knee के पास होता है. तो modalities ढूंढना try करो तो उसके ऊपर से you can prescribe. Right? Pankti.
जी सर.
Yes, from Divya. Sir, please hair falling के ऊपर एक सेशन कीजिए. कर रहे हैं. 3 या 4 घंटे का एक सेशन प्लानिंग कर रहे हैं. That is going to arrange soon. लेकिन ये फरवरी चले जाने दो उसके बाद. Question from Dr. Varsha. सर एक पेशेंट ने कुछ केमिकल प्रोडक्ट्स कंटेनिंग एलोवेरा यूज किया, उसके बाद उसका बहुत ही ज्यादा हेयर फॉल हो रहा है. इस केस में कौन सी मेडिसिन दे? So that is telogen effluvium, or you can think of sulfur, you can think of L-metallicum, you can think of petroleum, you can think of China, you can think of carbonation. Saumina, also in fungal infection, recurrence not cured completely, patient is frustrated, how to convince, how to tell in talk in explain because patient is not satisfied. Yes, you are absolutely right. So sometimes psoriasis is quite easy to manage, लेकिन fungal infection are not easy to manage. तो patient को explain करना ही पड़ेगा कि fungal infection itself is notorious, वो recurrence होता ही है. So we are here in homeopathy to cure it. तो time लगने वाला है. आपको ऐसा होगा कि भी मेडिसिन दी तो वापस नहीं होना चाहिए, लेकिन ये केस में होगा. तो बी रेडी, पेशेंट को एक्सप्लेन करो और आपको भी रेडी रहना है कि रिकरेंस हो सकता है. इफ रिकरेंस इज देयर, गिव कॉम्प्लीमेंट्री रेमेडीज, ट्यूबरकुलिन और बेसिलिनम, दैट हेल्प्स, और सिम्प्टोमेटिकली ट्रीटमेंट यू कैन गिव. लेकिन पेशेंट को मेंटली प्रिपेयर करना बहुत जरूरी है. पेशेंट डेफिनेटली गेट फ्रस्ट्रेटेड, लेकिन यूज हायर पोटेंसीज frequently, that helps. As we already discussed in our tinea session, ऑलरेडी वी हैव डन विद कीनिया, तो उसमें सब एक्सप्लेन किया है. Any question, any query, guys? So guys, we are concluding over here about the psoriasis. This is the vast topic. Each and every patient is different, but these are the common remedies which we are using in our practice. You definitely try in your practice and see the results. Okay, guys. See you in next session. Please suggest the medicine. Question from
Hello, sir.
Yes. Bolo, bolo.
Hello, sir.
Yes.
Sir, I have one question. I have shared one photograph in group hypopigmented patch over thigh. I want to ask about diagnosis.
That is on WhatsApp group. You
Yes,
shared in
yes, sir.
WhatsApp group, right? Let me check.
Yes.
मानसी ने शेयर किया. किसने किया है? उर्वी ने.
खुशबू सर.
खुशबू. Can you tag it?
Hypopigmented patch over thigh.
उसको टैग करो ना वापस जरा एक बार. शायद आगे चला गया है. नोट सी.
Yes, sir.
सर बाल स्पॉट का मैंने सेंड किया है पिक.
दैट इज रिड्यूस्ड डेंसिटी. और ये कौन एज कितनी है पेशेंट की? पेशेंट की एज डॉक्टर उर्वी.
35.
35. और मेल पैटर्न बांधने से आगे
नहीं सर, वो फीमेल है.
फीमेल है. फीमेल पैटर्न बांधने से इन डेंसिटी इज वेरी मच रिड्यूस्ड.
हेड इंजरी आफ्टर जो ऑइलमेंट लगाया था उसमें से अभी बाल ही नहीं आ रहा है. 14 इयर्स हो गया. और फिर 6-7 ईयर पहले वो एक्टिवा से गिर गई थी.
ओके. तो उसका स्कार है अंदर. इफ स्कार इज देयर आफ्टर इंजरी तो
नो सर, नो.
फोटो में तो स्कार नहीं दिख रहा है.
स्कार नहीं है.
ओके. तो इफ इट इज सप्रेस देन यू कैन थिंक ऑफ सल्फर. आप डेफिनेटली दे सकते हो. हैव यू ट्राइड सल्फर येट?
नो सर. आर दिया है.
आर्स आल्ब दिया है. ओके. एनी मोडालिटी?
चीली है, डिजायर हॉट और हेड इंजरी थी तो हेडेक का रिलीफ कोल्ड एप्लीकेशन से हो रहा था.
Ailment after head injury you can think of natrum sulf. है natrum sulf देखो. लेकिन that is sensorial. natrum sulf में sensorial डेफिनेटली होती है आफ्टर हेड इंजरी. आने का डेफिनेटली.
फास्टिडियस है और डिजायर स्वीट है तो आर से निकाल वो लाइकोपोडियम में कंफ्यूज हो गई थी.
ओके. आर्सेनिक और फास्टिडियसनेस है तो that works. लेकिन ये स्पेसिफिक रेमेडी में see is it vertex area? ये का
हाँ
ये
सर.
ऊपर
हाँ वर्टेक्स एरिया
vertex
है.
है ना. हाँ तो in
हाँ.
vertex you can think of Lyco and Barataka. When hair
सॉरी सर, लाइको और
the Lyco and Barataka, two remedies are there. Let me show you in repertory. Wait.
थैंक यू सर.
Wait. Let me confirm in repertory. Maybe repertory. Yes, let's talk about this depigmented. फिर कब से ये depigmented खुशबू?
सर 2.5 साल 2.5 ईयर से है.
कोई ऑइंटमेंट वगैरह यूज करा था ऐसा
सर
लगता है?
2.5 ईयर से है.
कोई ऑइंटमेंट वगैरह यूज किया था उन्होंने?
सर ऐसा कुछ ऑइंटमेंट यूज नहीं किया. नहीं ऐसा कुछ सर यूज नहीं किया है और कोई सिम्टम भी नहीं है सर.
और ये थाई का पोर्शन है ना? थाई का पोर्शन है.
हाँ सर थाई का है.
ओके. और पहले से ऐसा रेडनेस ही है?
यस सर. हाँ सर पहले से ही ऐसा ही है.
और एक ही पैच है और बॉडी पे कहीं पे है?
नहीं, सिर्फ एक ही पेज है थाई पे ही, उसके अलावा कहीं नहीं है सर।
और बढ़ता जा रहा है या स्टेबल है?
नहीं सर, बढ़ता जा रहा है।
That can be leukoderma, डॉक्टर। ल्यूकोडर्मा हो सकता है
ओके सर।
क्योंकि रेडनेस भले ही हो, वो स्किन की सेंसिटिविटी है, लेकिन डीप पिगमेंटेड एरिया है विच इंडिकेट्स, और वो बढ़ता जा रहा है, तो दैट कैन बी ल्यूकोडर्मा, हो सकता है, डेफिनेटली ल्यूकोडर्मा हो सकता है।
ओके सर। ओके सर, एनी मेडिसिन फॉर इट? एनी मेडिसिन सर?
कोई सिम्टम ना हो तो आर सल्फलेविडम। हेलो।
ओके ओके सर, थैंक यू। हेलो।
Yes, or self-evident, you can think. See, there is head, hair, falling, vertex, prom. We have three mark remedies, that is Barataka, Graphitis, and Lycopodium. Let me share screen with you. The screen sharing now, yes. Is it visible, guys? See, vertex, head, hair, falling, vertex, prom. We have Barataka, we have Graphitis, we have Lyco. That is in 3 mark remedies. We have sepia, we have acid nitric ammonia. Total 13 remedies are there. Doctor, you can think of any of these remedy which suits you with your case. Any question, any query, guys?
सर मांग में सिंदूर लगाते हैं वो एरिया में हेयर लॉस हो जाता है तब?
मांग में सिंदूर लगाना बंद कर। ट्रिगरिंग फैक्टर तो पहले बंद करना ही पड़ेगा। सिंदूर जब तक लगाएंगे तब तक बाल नहीं आएंगे, तो उसके लिए you can think of Lyco, that is also on frontal area. The Lyco also works on frontal and vertex. You can think of selenium in those cases. और frontal के अंदर और कौन सी I check.
ओके सर, थैंक यू।
देख लेते हैं forehead, frontal. Forehead में we have 7 remedies. Heparsal, Muxol, Netramule, Phosphorus, Silicia, Berana, Arsenal. You can think of these remedies. Or you can even think of Apis as it is allergic, or if it is side effects of something, so Apis आप use कर सकते हैं. Okay, guys. So we are concluding our session today. See you in next session. अगला session कौन सा है अपना?
Mostly like Sunday because 27 people voted for it.
कौन सा है topic?
Leukoderma, pityriasis alba, and
Yes, next topic we are going to discuss about leukoderma and pityriasis alba and tinea versicolariis. Okay. So we have just upload some poll. So if you are interested, if you are very much convinced, so the majority wins. हमारा next session we are going to arrange on Sunday. Sunday को arrange करते हैं क्योंकि next Tuesday I am not available and Dr. Nimisha is going to join us. So she is also not available. तो हमारा थोड़ा delay ना हो. That is why we are going to arrange on Sunday. तो Sunday का timing we are going to share you. 8:30 बजे या कुछ मॉर्निंग में 9 बजे बाद में रखते हैं चाय के साथ, वो दैट वी आर गोइंग टू डिसाइड, राइट? सो जो मेजॉरिटी पोल आएगा, जो मेजॉरिटी होगा उस हिसाब से वी आर गोइंग टू, ओके
सर इट विल बी ऑन मॉर्निंग।
हाँ मॉर्निंग, संडे इवनिंग आपकी खराब नहीं करेंगे। एंजॉय विद योर फैमिली करेंगे, मॉर्निंग में अरेंज करेंगे, दैट माइट बी नियर टू 9 और 10, 9-10 के आसपास।
ओके सर, थैंक यू।
ओके।